are so lucky today to be joined by Mary Michael. Mary, thank you so much for being here with us at One Mind at Work and our One Leader's Mind conversation. It's so good to have you with us today.
Thank you, Christina, for this opportunity. It's wonderful to see you and to speak with you as well.
Mary is Vice President of Patient Advocacy and Stakeholder Management at Otsuka America Pharmaceuticals, which is a really concise title for what to me at least seems like a really broad and diverse scope of responsibilities. Mary, you've been with Otsuka for more than 10 years, and over the course of your career, have worked with industry leaders in very different capacities. But the thread that seems clear to me in this impressive professional journey is the importance of storytelling in marketing with key opinion leaders and community engagement, working cross-functionally to really help shape the global vision for a business. I would love if you could share just a little bit of sort of how you came to this work and what really drives you in your current role.
Well, I have to tell you, I'm very fortunate to have found an organization where storytelling is really at the DNA of our organization. When I walked into Otsuka, it was all about storytelling to let us understand the company culture and the priorities and sort of the vision. And so it was a natural fit. And quite frankly, as I started to grow in my patient advocacy work, I started to ask individuals with lived experiences about their personal journeys. And when you listen to one story, it's just one story. But when you start to bring those stories together, you start to develop a rich tapestry of different individuals' journeys. And you might find some commonalities, but at the end of the day, everybody's journey is individual, and that's what we really appreciate here at Otsuka. So, was talking to individuals, finding out why they went into a disease category, if they were healthcare providers, and they were inspired by either personal, stories around mental illness or, kidney disease, or they were impacted by somebody that they might have seen in training. So it seems to me that everybody who's kind of drawn to this space has somewhat of a calling, if you will.
That's great. I love this analogy of a tapestry of these stories coming together to really provide us with a more rich narrative. And I think what you've just described in people gravitating towards certain sort of mission-oriented areas of work is really similar to what we see in the mental health space. It is rare to engage in the kind of work that we do around mental health generally, certainly mental health in the workplace, without that personal connection, right? People are really driven by their personal experiences. Otsuka is a key sponsor of the national PBS documentary executive produced by Ken Burns called Hiding in Plain Sight, Youth Mental Illness, which is premiering June 27th and 28th very soon. Can you tell us a little bit about what made you decide to support this film?
Sure. Well, Otsuka is a healthcare company that's driven by our purpose and defined by our combined beliefs, if you will. We have an unwavering belief in doing more. And so when we were presented with this opportunity to collaborate with award-winning filmmaker Ken Burns to capture the individual stories around serious mental illness and talk about some very serious topics like suicide, major depression, schizophrenia, and bipolar, we really felt like we could not step away from this, and we had to lean forward, if you will, because only Ken Burns could tell such an incredible array of different stories from so many different perspectives, not only from the individual with the lived experience, but quite frankly, from family members and supporters of that individual. So this has been a multi-year journey, if you will, starting with the Well-Beings project. And with that, what we did was we took opportunity with the COVID crisis or the shutdown to hold virtual gatherings so that we could have candid conversations. And we were joined by individuals who were generous enough and so candid to share their personal stories of mental illness so that hopefully others could, benefit from their words of wisdom and the paths that they had traversed.
We know that it's so important in this work to get these stories out there, to help people feel like they're not alone in navigating some of these experiences, and also hopefully to communicate that there is hope, right? That it's not all doom and gloom, it's not all despair, but we should have cause for optimism in the work that we do. Perhaps along those lines, given that Otsuka has engaged in some of this work with media, what do you think is missing in media portrayals of mental illness and recovery for the public?
Oh my goodness, where do I start? Um, so I think that with COVID, we've learned that language actually matters. The words that we use, the way that we talk about certain situations, and that actually applies to mental illness as well. Just like we have become culturally competent as a nation, as a humankind, if you will, I think it's very important for us to listen first, listen to stories, listen to individuals' perspectives. They can tell us and inform us and educate us what is meaningful to them, as well as the language to use. So if the media could really listen in, lean in, and understand different perspectives, then they may start to talk about mental illnesses and that road to wellness and recovery and just, well-being, in a much more kinder, empathetic, and any other way, like they would treat any other cultures and other diseases as well. So there are some things that were used to describe cancer or HIV/AIDS, and that was in the past. And I know the media has done a great job of sort of embracing that community and using that language. So I think that if the media were to do that, we would find incredible collaboration between the community and those who want to support them.
That's really great. I think, the more that we can engage in partnership in this space, the better impact we can have collectively. And I think bringing together diverse stakeholders like industry, like media, like nonprofits is a way for us to accelerate the work that we're doing. This film with Ken Burns is not the first foray for Otsuka into media engagement and support. You've also been very active and supportive of the Reaching the Light documentary about major depressive disorder. So this is, again, I think in line with your previous comments about really being comprehensive, addressing several different conditions and states along the mental health spectrum. Can you share a little bit about how you're thinking to use the documentary Reaching the Light in support of this broader work?
Sure. Well, first of all, we're so grateful to One Mind and One Mind at Work, and to Brandon Staglin for really bringing this, opportunity to Otsuka, not only to us, but to Lundbeck, another collaborator. And what I can say is that, we collaborate with patient advocacy organizations, with individuals, and with professional organizations. And we plan to collaborate with them to showcase this opportunity, to share it amongst their constituents. So whether it's people living with or those who are supporting individuals with mental illnesses, we hope that this documentary reaches every single individual, because it's such a great educational opportunity and reinforcement, if you will, of people's journeys and individual journeys from so many different perspectives, that I think it's an incredibly valuable opportunity for everyone.
That's great. You mentioned One Mind and One Mind at Work, and you are sitting in a position that to me feels a lot like a nexus of all of these different stakeholder communities and areas of opportunity to spread the mission, to share information, evidence-based information about mental health in the workplace. How do you see media really amplifying this work that you do in a cross-functional capacity and your mission at Otsuka?
So I think that by collaborating with organizations, and One Mind at Work also gives a great opportunity to reach some constituents that are not in this mental health space. So I think it's very important that maybe they carry a lot of these stories out. And I think collectively, as we create this chorus, this echoing effect, if you will, about the importance of everyone's mental health, I think that that's going to really spread and start to overcome a lot of the stigma that we might have seen in the past. To be quite honest, I also think that COVID, is going to amplify or at least expose the mental health crisis that we're starting to see because of some of the consequences of the COVID shutdown. So, with that being said, I think that media is looking for any and all types of stories and opportunities to, number one, expose and say, hey, it's okay not to be okay, to use some vernacular from some spokespeople, but it's also seeking for different ways that we can support one another as we are dealing daily with anxiety or depression or any other mental illnesses. And the workplace is certainly one that is so very important. So in terms of media, I think they're seeking for solutions and some stories. And so I know that with our rich voice at One Mind at Work, at Otsuka, and some of the other collaborators, that they will come to us and seek some of those answers.
That's fantastic. I love the idea of a chorus. And as the chorus grows, that volume just swells, right? And we really help to spread that message and to make it louder and a lot harder to ignore. Last question, what's next for you on the media front?
So, we're going to be exploring to see what happens with the documentary. We're collaborating with PBS, with WIDA, and with other sponsors to see what the opportunities are. And so June 27th and 28th are the official airing dates on PBS. And we feel as though while, as that starts to amp up and reach the public area, that the media will reach out to founding sponsors like Otsuka and other sponsors of this documentary, and also come to some of the different websites that we might have created individually as, companies and organizations that are doing a lot of storytelling in this space. And so we're going to collaborate with media as they come to us.
Excellent. I love that final plug, June 27th and 28th, Ken Burns. Really appreciate it. Mary, thank you so much for your time today and for all of the incredible work that you're leading at Otsuka. We're so lucky to have you as part of the One Mind at Work and One Mind Network. And thank you for your time.
You're feeling anxious, afraid, alone.
I haven't been able to see my family or my friends.
Families that struggled to find mental health care before find it even harder now.
Feel a lot of guilt in not being with my family.
Are there solutions? Visit onemind.org, seeking the answers, bringing help to the front lines, accelerating brain health for all. Help us fund new treatments at onemind.org.
I'm living my best life.